Hi, my name is Chase. I'm going to be your social worker, and I'm going to be working with you for the next, few weeks or months or however long it kind of takes us, to get sorted out. So what is your name?
Hi, my name is Maddie.
What is your full legal name?
Um, Maddie Muse.
Maddie Muse. And Maddie, when is your birthday?
March 25th, 2003.
All right, and just for the record, we are completing this evaluation and this assessment on the 18th of October. All right, of 2024. All right, so I'm going to ask you some questions, and we're just going to talk a little bit about your history, your family history, your medical history, just kind of about you. Answer in as much detail as you can or as you're comfortable with. And if at any point there's anything you don't want to answer or don't want to talk about, that's fine. All you got to do is say so. All right? So, how about a little bit about why you're here? What's going on? What are you feeling? Any symptoms? Just sort of what's going on.
Um, I would, I'm here because I've just been kind of feeling for the past few months, I started a new job and it's kind of been really tough on me because I keep having moments where I just get super nervous and kind of like increased heart rate and just not really it's I used to not really be like that, and so it's been kind of hard on me, and it sometimes it'll increase and get worse, and I kind of go into like a panic mode.
Okay, so what specifically increases and gets worse?
I would say just the feeling of being nervous and uneasy.
Okay. And so feelings of being nervous and uneasy. So you said you go into a panic mode. Can you describe a little bit? Can you describe what panic mode means?
Yeah, I kind of don't know like what to do. I kind of start shaking. I can feel my heart beating really fast. I get kind of nauseous and kind of trying to like catch my breath and um, yeah,
Okay.
just not really in the right. Yeah.
All right, and then you said you're nervous and uneasy. Is that different, or is that kind of just more of the same, or is that
I would say that I feel that, and sometimes it'll get worse and kind of lead to that, or else I'll just feel like that kind of nervous, uneasy feeling, like I'm kind of like waiting for something to happen almost.
okay? So this is what you feel before the panic.
Yes.
Okay. All right, and how long of this has this been going on?
I started a new job about 3 months ago, so I'd say around then.
So that's when it started. Okay. Um, does it impair you at all? Are you able to work through it? Or does it kind of stop you in your tracks? Does it affect you at work?
It definitely affects me at work and kind of stops me in my tracks. I can't really like focus on what I'm doing in the moment, and so it kind of takes me away from it.
All right. And what do you do when you feel these things?
Um,
Like, what do you
well, I kind of
currently
get
do to
embarrassed.
cope?
Um, I just really go into the bathroom and try to take a few minutes to uh, like pull myself together, and, but it doesn't help.
It does, okay. So you say it doesn't help. Does that mean you're in the bathroom for a long time? Do you have to go home from work?
I've had to go home a few times from work. Even I've before even getting to work, on the way to work, I've had to turn around and go back home. But yeah, either I'm in there for a little bit trying to calm down, or I end up just leaving.
Okay. All right. Have you ever been suicidal?
No,
Homicidal?
no.
What about any kind of psychotic symptoms? Delusions, hallucinations?
Um,
No. All right. Have you ever seen a psychiatrist or been in any kind of therapy?
I saw a therapist when I was a teenager, but that's about it.
But not since then?
No, not since then.
Okay. Have you ever taken any kind of psychiatric medication?
No,
No. Have you ever completed any kind of psychiatric inpatient care
no, I haven't.
or been hospitalized, whether that was voluntarily or involuntarily for anything, any kind of
No,
psychiatric issue? Okay, no. Have you ever, and you've never tried to commit suicide? I know we said you didn't have any suicidal thoughts right now, but have you ever tried to in the past?
no, I haven't.
Okay, and then what about your family? Any kind of psychiatric issues within your family, mood disorders, any kind of anxiety, substance misuse, and siblings, parents, grandparents?
My sister, she struggles with substance misuse.
Okay, what does she do?
She is, she's just, ever since she had a surgery a few years ago, she's just been really bad off on drugs, and we've tried really hard to kind of give her that help that she needs. She's been in and out of rehab kind of for the past few years, and
Okay, are you saying it started with prescription medication then?
yes.
Yes, okay. All right, do you currently use any kind of drugs or alcohol?
No.
So, no drugs, no alcohol at all, socially, ever?
Um, I would say I drink maybe like 2 to 3 times a month with dinner with friends.
Okay, are you getting drunk, or is this just kind of drinks with dinner and then headed home?
No, just drinks with dinner.
Okay. So now a little bit about kind of like your background, your family's background, your childhood, all that. So where did you grow up? Where were you living as a kid?
I grew up in Stamford, Kentucky.
Okay. Who'd you live with?
I lived with my mom, my sister, my brother, and my stepdad.
You ever been married?
No,
Do you have children?
I do not.
What kind of education do you have?
I completed high school, and then I went on for my associate's degree.
Okay. When did you graduate from high school?
In 2019.
And then when did you complete your associate's degree?
In 2022.
And what do you
2021.
have? 2021. And what do you
Yeah,
have that degree in?
Finance.
All right. Have there been any stressors in in your life recently, whether it's a death or maybe even a birth of a family member or major moves? Anyone been divorced? Anything like that?
I would say I moved a few hours away from my family, so it's definitely been a stressor being far away from them. as well as my sister, and not being like closer to kind of help out.
All right, and when did you move?
Uh, a little over 3 months ago.
So when you started your new job?
Yes, yeah, I moved for the job.
For the job. Okay, and how far away? You said you moved far away. How far away is far away?
Uh, it was just a few hours, about 4 hours.
Is anyone in your family in the military?
Yes, my stepdad was.
And what branch of the military is he in?
Army.
All right. Was there any kind of abuse in your family ever as a child? Now, physical, sexual, emotional? Whether that was towards you or between other family members, even if it didn't include you.
Um, no, when I was younger, I would say I don't remember it, but my mom and dad, they separated because he was physically abusive.
Okay. Buried it. Um, are you close to your family now?
I would say so. I talk to my mom a few times a week.
So you would say they're a good support system. You could count on them and they'd help if needed.
Yeah, I think so.
Okay. Do you have any legal problems? Criminal, civil, anything like that going on?
No.
Has there ever been any kind of legal issue?
No.
Um, do you have a job?
I do.
And what is that job?
It's the job I just started. I'm an accountant at a tax office.
All right. Do you like it?
Um, it's been okay.
All right. Do you get along with management, other coworkers?
Yeah, for the most part.
Do you have any current medical condition? This is a bit about your medical history now. We're going to move on to. Do you have any medical conditions that are not psychiatric or related to your mental health?
No.
Nope.
I mean, besides when. Sorry, go ahead.
Just anything. Besides
Just
what?
besides, just when I got my appendix taken out in high school.
You got your appendix taken out. Okay. All right. Are you taking any medications daily?
No.
All right. History of hospitalization?
No. Besides the appendix.
Besides the appendix. Okay. Have you ever had a major head injury, a concussion, TBI, anything like that?
No.
All right. And any allergies, medication, food, anything?
Not that I know of, no.
Not that you know. All right. Well, Maddie, this was a great start. This was, I think, a lot of information. So I am going to go over this and we will meet probably this time next week if that works for you. And we'll go from there. And if you have any questions, if you have any concerns, if there's anything going on, feel free to reach out to me. Obviously, if you have an emergency, 911 will be your first call. But it was really lovely to get to know you today a little bit and to meet you. And I hope that we can help you feel better.
Thank you.
All right, I'll see you next week.
Yeah.